Welcome to Politics Done Right. I am your host, Egberto Willies. This is a progressive program that will take the mystery out of politics. This is the program that will encourage you to make sure government becomes we the people. Whether you are liberal, progressive, conservative, or otherwise, you get to air your point of view. We are an independent media outlet that, unlike mainstream media beholden to corporations, we only owe allegiance to you. Remember, you can also send me a tweet at EGBERTOWILLIES. That is at Egberto Willies. Let us engage. It is Politics Done Right. Well, folks, welcome to one more edition of Politics and Right. I'm Egberto Willies, your host. Thank you so kind for being a part of the show. We are going to have a great show for you today. And of course, numero uno, the first person in the chat today was Yvette Avery Herod from Atlanta, Georgia. She is the winner. Secondly, Bridge MCP from Binghamton, New York. Número dos. Número tres, Michael Rudden from Brooklyn, New York. On my way home. See you in 5. All right, we'll see you in 5 when you get off the subway, Michael. Then we have fourth, Joe in from Los Angeles, California. Welcome aboard. And Melanie Keelan cannot be denied from Barcelona, Spain. And of course, we have Patrick Magna from Houston, Texas says, meow. Welcome. Patrick, how you doing, my brother? And then in the house as well, Eric Hayes from Kingwood, Atascocita. And para ver, Edward Peña from Houston. How you doing, Edward Peña? No sabes cómo hacer la ñ para la N. Para el español, ñ. You know I'm messing with you, Edward. I think this is the first time I'm calling you out. He says, Edward Peña says, make it make sense from Houston. We are going to make it make sense to you, brother. And what else have we got here? Who else is in the house? If I missed you, please call me out. Anyway, Lee the Bearcat from Austin, Texas. Yo all, it is hot. How hot is it in Austin? Right now in Houston, it is 82 degrees. It's hot as well for this time of the year. 82 degrees. How are my peeps doing? We got a lot to talk about today. Anyhow, I didn't write this up, but I'm going to start this way. Well, actually, I am going to start it with reading from Common Dreams. Actually, I think I had the piece out. Let me go to Common Dreams and talk about it, because it seems like we need to have AOC challenge Schumer. These guys, I tell you, sometimes their gutlessness sometimes is so upsetting. But anyway, let me just show you guys on the screen to start with. Para ver está aquí. Calls for AOC to primary Schumer mount after gutless surrender. We don't know if the surrender is official yet, folks. Paul Fleming is in the house from Atlanta, Georgia. Hey, here's the deal. The phone lines are still open to go ahead and call those senators. He's only got 3 so far. It's Schumer, the guy from Pennsylvania, and one other claim that they're going to vote. The lady from Mastos from Arizona. Is it Arizona? No, Mastos is from. Is she from Arizona or New Mexico? Arizona, New Mexico, or Nevada? I don't remember which one. One of those states she's from. Anyway, that's who's calling out that she is going to be voting for it as well. So, folks, get on those lines. Call those senators. Tell those senators absolutamente no. Alizarin Dreams from Summerwood is in the house as well. Welcome aboard, Alizarin Dreams. Hey, call them now. The answer is no. Do not support the continuing resolution. Say no. It cuts a lot. It cuts food. It cuts Medicaid. It cuts quite a few things that will affect quite a few people. Let's get it, folks. Anyway, the story is calls for AOC to primary Schumer mounts after gutless surrender. Schumer should step down from Democratic leadership or be forced out and let someone actually willing to fight Trump and Musk take his place. The Democratic Party erupted in anger late Thursday after its longtime Senate leader, Chuck Schumer, capitulated to the Republicans on a government funding package that would slash critical programs and bolster the Trump administration's lawless assault on federal agencies. The fury wasn't limited to the party's progressive wing, which was predictably incensed. The fury was incensed by Schumer's announcement that he and a sufficient number of other Democrats would vote in favor of advancing the GOP bill to avert a government shutdown. According to Axios, even centrist Democrats were among those voicing support for primary challenge against Schumer, with members floating Representative Alexandria Ocasio-Cortez, Dan Goldman, and possibly 2028 candidates against the minority leader. One lawmaker even vowed at the House Democratic retreat to write a check tonight supporting Ocasio-Cortez, the outlet noted, citing an unnamed senior House Democrat. CNN similarly reported that House Democrats, who, with the exception of Representative Jared Golden of Maine, unified against the Republican funding package, are so infuriated with Schumer's decision that some have begun encouraging Ocasio-Cortez to run against Schumer. Multiple Democrats in the Congressional Progressive Caucus and others directly encouraged Ocasio-Cortez to run on Thursday night after Schumer announced, said one unnamed lawmaker who told CNN that the party members were so mad at the Senate leader that even centrists were ready to write checks for AOC for Senate. Ocasio-Cortez, who called Schumer's reversal on Republican funding bill a huge slap in the face, said amid the mounting primary calls that she focused on mobilizing against the GOP measure in last-ditch attempt to sink it. We still have an opportunity to correct course here, and this is my number one priority, the New York Progressive told CNN. I think there is a wide sense of betrayal if things proceed as currently planned. And folks, it hasn't been voted on yet. You still have time to get to your senator, one of the crucial senators. I don't have a choice. My two senators are, on the evil side already. All right, with Senator Rand Paul of Kentucky expected to break ranks, the Senate GOP needs at least 8 Democrats. We can get to 2 Democrats, folks. Of those 8 we can get to 2 and stop them. Opponents of the GOP measure, including the largest union of federal workers in the country, if the people who DOGE is laying off is saying no, say no, why the hell would Schumer say yes? Why would he say yes? Instead of forcing Republicans to own their extremism, Schumer gave away one of the only pieces of leverage Democrats had from 2026, wrote Democratic strategist Walid Shahid. This wasn't about whether a shutdown is a risk-free. No fight ever is. It was about whether Democrats were willing to impose a cost on their opponents for governing through blackmail. Instead, Schumer made the kind of move that tells Republicans they can keep pushing. Of course, that's what he did. Justice Democrats, a progressive group that helped Ocasio-Cortez upset a top House Democrat in 2018, said Thursday that the corporate Democratic leadership is all talk and no fight. I agree. Gutless, spineless, and utterly unqualified to lead, the group added. Schumer should step down from Democratic leadership or be forced out and let someone actually willing to fight Trump and Musk take his place. Now, let me give my narrative to that, because here's the deal. What they've done is they have taken the narrative and given it to the Republicans. He goes up in the galleys and not the galleys on the floor, and he says, "We can't shut down the government." Wait. How dare Schumer goes out and take the blame prematurely that if the Democratic senators don't vote a certain way, they will be the ones shutting down the government. You would never ever hear a Republican do that. Let me teach Schumer something. Johnson gave a press conference before he knew he had the vote on the Republican side. And he was already, again, remember, they have a clear majority in Congress. Johnson does, the Speaker of the House does. He have a clear majority in Congress. He thought he was going to lose 3 to 5 of those Congress people, which means he would have needed 5 Democrats to vote with him. So what he did is he preemptively said, if that bill didn't pass, it was the fault of Democrats, even though they have a clear majority, something that's not there in the Senate. The Senate requires cloture, which means to debate the bill, they have to get cloture, which means 60 votes. If they don't get 60 votes, they can't debate the bill. If they can't debate the bill, they cannot pass the bill. Whether you have 52 or 53 votes, you can't pass the bill. What Democrats, what sensible Democrats have been saying is immediately point out that we don't know what about that bill. That bill had nothing from Democrats at all. They did not allow Democrats to participate in the writing of that bill. So how dare us vote on a bill we had no participation in? No minority participation, no minute participation. We had no participation in the bill. How can we vote for something that we didn't have anything to do with? So therefore, if Republicans want to pass a bill, they need to come and negotiate with those who are a part of voting for the bill. And if they don't do that, Republicans are shutting down the government. The wimpy Schumer goes out and says, if we Democrats vote against this bill, we are shutting down government. How stupid! Now all Republicans need to do is get a clip of Schumer. You will not find any clip of any leader in the Republican Party mentioning or insinuating that Republicans are shutting down the government. You won't have any clip of that. Now, the Republicans have a clip of Schumer all over the place on Chris Hayes saying we can't shut the government down. You're not shutting the government down. It's Republicans doing that, Schumer. You wonder about whether these guys are complicit with Republicans. You have to wonder if these guys are complicit with the evil ones. And I must say that because I know Schumer. I've spoken to Schumer at Netroots 3 or 4 times. He's not a dumb guy. He's a very smart guy. Why would Schumer go on TV and actually associate shutdown and Democrats? Shutdown and Democrats. Yes, he needs to be primaried. I don't know if it's Ocasio-Cortez because I think I love Ocasio-Cortez, the way she controls in the House. And if she goes into the Senate, she'll go in as a junior senator and they'll probably clip her wings. But I tell you, it is very, very upsetting the way these guys are doing. All right, let's go ahead and read some of what you guys have to say here. Para ver. So let's see. Bear with me, guys, as I find your wordiology from the sensible ones, that is. Paul Fleming says, as he faces Senate confirmation, remember that Dr. Oz pushed Medicare privatization plans on his show, owns $600K in stocks of private insurers. Yes, and today he never would say that he wouldn't cut Medicaid or Medicare. He wouldn't say that at all. Let's see what else we've got here from Paul Fleming. Okay, let's see. Joanne says, I called my senators and others. I'm furious. It felt good. Padilla staffer said, absolutely no. Otherwise, I got voicemail, but good to do. Cursing silently inside. I hear you, girl. Welcome, Maywood from Long Beach, California. Michael Ruddin says, we're up against an awful choice. Keep government running while allowing Republicans to gut Social Security, Medicare, and other government programs, or shut down the effing thing down. The Hill, dozens of Democrats penned letter to Schumer urging him to reject CR. 21 Democrats signed the letter writing congressional Democrats must defend the rights and powers of the offices we are elected to hold. Congressional Democrats must fight for our constituents and for the American people against White House that sees itself above the law. We urge all Senate Democrats to stand with the House Democrats and with the people. Reject the continuing resolution and force House and Senate Republicans back to the negotiating table so we can pass full-year funding bills that shield our investments in the American people from the Trump administration. And here is the thing. Here's what Schumer is scared of. Oh, if we don't keep the government open, the executive is then responsible for allocating funds. Very true. Let them do the allocations of funds during a closed government, because they will be doing it by their lonesome. It will be support with zero Democrats. Support with zero Democrats, and we know all that they're doing is hurting rural America and everywhere else. So shut down the government if they want. Let the Republicans shut down the government. And then to give Trump the authority to say where and what to spend. There wouldn't be enough to cover all the things that they can't cut, that they're cutting. It won't be enough. So let them do it, and they can take all the blame for the allocations that Trump makes. And let it last 45 days until he comes in. Come on, folks. Democrats under the establishment are horrendous at fighting. We need fighters. That's what we need. Let's see what else I got before. I have a video, 17-minute video that I need to play here, brothers and sisters. Let's see what else we got here. Bear with me as I scroll down. AOC, Shekel Broadster, don't think I ever heard from you. Where are you from? Welcome to Politics Done Right on the chat. AOC is very far from radical narcissism. That is what ruined everything in this system. Incentives is radical. Exactly. AOC is not radical. It's only seemed radical because she is where Democrats used to be before the big shift right that started with Ronald Reagan. Let's be clear. All right, folks, the second topic of today is I interviewed, well, I tell you what, I'm going to just play it right now and you guys will see what it's all about. Let's get busy one time. Welcome to another edition of Politics Done Right. My name is Egberto Willies, your host. Today we're honored to have Tom Lawry. Tom Lawry is a future of healthcare expert, a leading transformation advisor, a keynote speaker, and a best-selling author. He is the author of Hacking Healthcare and the upcoming book, Healthcare Nation. The future is calling, and it's better than you think. Welcome to Politics Done Right. How you doing, Tom?
I'm doing great. It's great to be with you. Thanks for the invite.
Absolutely. So now, interestingly, I'm going to start with the entry because you're saying something that I would like to believe. You say it's better than you think. Explain.
Well, I believe America's at a crossroads and we have a choice. Look at what's happened with healthcare and the healthcare reform debate over the last couple decades. And that's one option. The option that I'm seeing is to say, we as citizens must take back our right to better health and how it's directed. So my new book, Healthcare Nation, is a positive approach to say, let's stop waiting and let's start mobilizing as citizens. Let's start looking at defining what we think should happen rather than waiting for the politicians and others to either define that or decide on our behalf. So, I think about things like healthcare today is similar to what civil rights were in the 1960s. And if you look at the history of civil rights or any movement, women's health, suffrage, people got tired of waiting for politicians and leaders to do the right thing. They started mobilizing to come up with a common vision. And when that happened, and when people mobilized in force, that's when change happens.
Now, usually, whenever people mobilize and force, there has to be a catalyst. There has to be something that lead them into that. Well, we can't take anymore, and we're going to do it. I think we should have been there long time ago. I think our healthcare system is a fraud, and it has been a fraud since its inception because of the way it was put together. Now, what is that catalyst for you? What do you think, based on your writings, that we ought to be doing that is different and doesn't necessarily involve politicians?
Well, again, I bring it back to little by little, it impacts everyone listening in your daily lives, whether you access and use the system or not. So America spends 3 times more than any developed country per citizen. Mm-hmm. And yet, when you look at our track record, we have the worst performance on quality, on outcomes, on effectiveness, on access. 43% of Americans are un or underinsured. Our citizens among the least healthy people in the rich world and most likely to die at an early age. And I can go on and on and on, but if you look at the data, and then I'll take it a step farther, I've got a chapter in the book called What Would Martin Think?, where we look at healthcare is bad enough across all segments. When you look at healthcare and people of color in America, it's not a good story. We have serious problems that are not being addressed. They're compromising the health and well-being of so many people. Meanwhile, it's costing a lot of money. And it's like, if this were in our portfolio as a stock for 401, our 401k would be firing our investment broker.
You know what is interesting is I see that you understand the problem perfectly. I wonder, and I have this issue when I talk healthcare with a whole lot of different people, irrespective of ideology, and that is people don't want to come to the fundamental reason to why our healthcare is the way it is. And I'm going to throw something out there. I'd like you to address it the best that you think you can. I think that by design, our healthcare system is behaving exactly as it should. We don't have a healthcare system. We have a system that is designed to make profits in a capitalist society. I'm not against having a for-profit society, a capitalist society. I just don't think it belongs in healthcare because, again, it's working as it should. The efficient allocation of resources, no, but the maximization of profits for whatever service we provide, and we took that right into healthcare. Your thoughts on that?
Well, I'd go back to something you said a little earlier and back into that. You said something that reminded me of something the famed newscaster Walter Cronkite said years ago. He said, the American healthcare system is neither healthy, caring, and to your point, nor is system. So let's start there. The system, does amazing things if you get sick and you have lots of money or really good insurance. But the point to really dig deeper on, and I think you're starting to tease it out, is when you look at the American healthcare system, it does little, with those amazing things to keep most citizens healthy, well, or happy. And, let's go a bit deeper. So, the American healthcare system runs on what I call the break-fix model. So to you and your listeners, would you buy a car from a company that would only service your car once it stops running?
Oh, no.
How about a computer system that they sell to you, but the only time they'll look at it is when a virus has rendered it inoperable? That's the American healthcare system. 97% of the $4.7 trillion, which, by the way, is your money, goes to the break-fix model. They only take care of you when you're sick or ill. Meanwhile, 3% of that money goes to prevention, even though so many things like chronic conditions that RFK is talking about, with the right moves and activities, are totally preventable. So, people are doing their best to run on the economics. And one of the co-founders of Berkshire Hathaway used to have this phrase that I think applies. He said, show me the economic incentives and I'll show you the outcome. So what we have to do is start looking at, is that the way we want it? Would you rather have, more than 3% going to things like wellness and prevention that gives more citizens the opportunity to stay healthy? And then the final issue, and then I'll stop, is, America is the only developed nation where healthcare is not a right. And it's a hotly debated topic. And the simple question is, do you believe healthcare is a right? Yes or no? And if you believe yes, it's a right, then the deeper discussion is, what should it be a right to that all citizens should have access to?
Well, let me ask you, Tom, do you believe healthcare is a right?
Well, I personally believe it's a right. The deeper discussion is right to what? Everything modern medicine can possibly provide, or a baseline of services that, if was afforded to all citizens, one, would keep them healthier. Two, it would actually lower the cost of healthcare. There's another little dirty secret in healthcare known as cost shifting, which is healthcare's, economic version of whack-a-mole. So you take, people are underinsured. They wait until way too long when they're really sick, and then they present at a hospital or doctor's office. When they're provided care, the cost of that care has to be borne by someone. So the healthcare system basically takes the cost of caring for those who are uninsured, and they load it into what you pay if you have insurance, or what the businesses pay, for the cost of providing insurance. So one way or the other, whether healthcare is a right or not, we're all paying for it. And I think it would be a better discussion to say, well, if everyone had universal access and we didn't have to shift those costs, I mean, it's very similar to what Walmart does with, they take all the theft that occurs and they basically package that, and you pay more for whatever that is. That's happening in healthcare. And the question is that the right way to run things?
No, I personally, I don't think so. I am actually a proponent of some well-designed I don't want to say Medicare for all because I have too many connotations, but healthcare for all, where we are serviced out of a general fund. I don't even know why. I think the risk pool for healthcare should be the risk pool of the country. People talk about having health insurance companies because they want to have different risk managements, and that's what they do. The only reason you have to have risk management is to make a profit, in my opinion. Well, not in my opinion. That's actually a factual statement. If we have one risk pool and we implement exactly as you state, which is we shouldn't be spending just 3% on wellness, but we have one risk pool. And well, I tell you, better than that. Why don't you give me your healthcare utopia?
Well, some of this is in my book, and I've been asked that a lot. If you look at most books on health reform, and by the way, health reform is a trigger phrase for all of those sorry conversations we've had through the decades that don't work. So I don't use that anywhere in my book. Two, in writing this book, if you look at the books written on fixing healthcare, they follow a pattern of first, trash it throughout all the stats for why it's bad, and there are plenty of those. And then most books then go on to blame someone. It's big pharma, it's the greedy doctors, it's fill in the blank. And then the third and final thing is that all that is a setup for the, quote, expert to then tell everyone else what we should do to fix it. I've got my view, I'll give it. But part of this, to me, is mobilizing to say, as citizens, let's stop being disempowered by having others tell us, and let's start looking at how each of us can define the future we want. Because once again, it's your health, it's the health of your children, and it's your money. So my view, and I tee it up in the book, is, it's crazy to spend 97% of our money on break fix and 3% on preventive services. And so, for example, 30 million Americans die each year prematurely from preventable diseases. I mean, think about that. We probably all know someone who died early from something that was preventable. 27% of the U.S. healthcare spending right now goes to managing those medical conditions once they're sick that are totally preventable. So if I were the Grand Czar, I would start saying, this is crazy. Let's start putting more money into things like prevention, things like wellness, other things, because you mentioned risk pools. And part of this is, how do we define health and health care, and how do we find it differently? So let me pose another question. When it comes to predicting the health of an individual or a population, which is a better predictor, your genetic code or your zip code? And
your zip code.
They're both important, but I bing, bing, bing. Yep. You just won the prize. We often talk about, in the break fix model, risk pools and other things. And if we look at things like what we know as social determinants of health, to say, there's a reason vulnerable populations are more likely to be obese than those who are not. And typically it's, they live in places where there's little access to healthy food. There are food deserts. There are few places that are safe to walk. So when we talk about health and reimagining, I'm encouraging people to think very broadly. Or the other thing that has come up just in the last few months, and anyone from California knows this, is like, is environmental policy the same as health policy? Because I look at what's happening in Southern California, whether it's the immediate effects of those fires, the amount of pollution that then gets spread around the world, affecting people with things like pulmonary and asthma. As we think about reimagining health, should things like social determinants be part of it? Should things like our environmental policies be part of it? And my belief is yes, those holistically add up to keeping people healthier. We still need a system that takes care of those of us when we get sick or ill. But imagine starting to do more to give everyone the opportunity. They may not take advantage of everyone the opportunity to be healthier.
That is so important, and I'm glad that you connected all those dots together. Now, look, before I go, I always ask a very important question, because we don't want you to just come and tell us everything about your book. We want people to get that book and be able to be nourished by the book. I didn't read the book. I read the table of contents, and I skimmed through. I have to go through a whole lot of those, and I must say that I'm very impressed. And it is something that I hope people would go out and get, because it's altogether a different paradigm that we should be aware of and that we should do something about. So I always ask this as the last question, and that is, what should I have asked you that I didn't, and what would you like the audience to know? And take as much time as you need.
Well, I think you've done an outstanding job of asking questions in the time we have. So bonus points aside, I can't think of anything there. The book Healthcare Nation, it officially launches March 28th, all major booksellers. And I guess what I'd say is this, it's back to, we're talking about our health. We're talking about our future, our children's future. And for anyone who says, it can't be done, I can't do anything to change it, I would just say, look at the trajectory we're on, which is we're heading for disaster. So I bring it back to, we all have the power to have a view, to be educated, and then to do something to act on it. And I start the book in my preface, and my editor told me it was really a horrible way to try and sell a book by starting with this story. But I start the whole book by telling the story of Rosa Parks and saying, I wonder what Rosa Parks had for breakfast the day she made history. I mean, did she sit there and just think it was going to be an ordinary day, or was she staring into a coffee cup planning something? But when you look at the story of Rosa Parks, that one action started a movement. It was a flashpoint. And my whole point is, we need a Rosa Parks moment for healthcare, and we need it soon.
Well, Tom, I think we are in that moment right now, especially now with what's happening from budget cuts to just about everything. So, Tom, Lawry, I really appreciate you coming on to Politics Done Right. Folks, don't forget the name of the new book. First of all, I want you to check out Hacking Healthcare. But the new book that's going to be launched on the 28th is Healthcare Nation. The future is calling, and it's better than you think. And that's what got me. It's better than you think. It's hopeful. It is hopeful. And what we want is hope with grassroots action. I think Tom Lawry has the pill for that. Tom Lawry, thank you so kindly for having been on Politics Done Right.
Pleasure. Thanks for having me on.
All right, folks. I hope you enjoyed that. When I came across that, and the publicist came to me about that book, and it wasn't the title of the book that really turned me on. It was the part that says, the future is calling, and it's better than you think. Because, as far as healthcare in this country, it has never been better than we thought. But what his basic message is that we have to finally, once and for all, take control. And I'm with the brother. I am with the brother. We've got to take control, and it starts with us. It starts with us forgetting about all those people on the right that are fooled into believing that somehow medicine, public medicine, is something wrong, not understanding that math behind it. As far as Michael Rudden, let me tell you, I do believe in Medicare for all. The only reason I said healthcare for all is too often, once we say Medicare for all, people tie it into Medicare, Medicare Advantage. And what has happened in our country is because they've conflated Medicare Advantage, which is lousy, with traditional Medicare, which is better but still has that 20% problem. What happens is those people who are framed by a bad working quote unquote Medicare Advantage, or for them, would say, well, why would I want to put this on everybody else? We have a lot of educating to do. And in effect, that is what one of the things that Brother Lawry is talking about as he speaks about this particular issue. Anyway, before I go to the second video, anybody wants to call in and discuss any of this, area code 281-823-7747. I'll wait for a couple minutes to see if anybody wants to call in. Again, that number is 281-823-7747. Una vez más lo voy a repetir. 281-823-7747. By the way, I don't know if I told you guys that at KPFT, one of the, I'm going to call it a gimmick that I was doing to get us to fund the station is I had this program says, have coffee with Egberto, and I'll drive whatever part of the Houston area and meet somebody. And if they donated $250 to KPFT, I'll drive out and have a coffee with them. I've done that several times before. Today was one of the days that I went ahead and drove out to meet one of the people who donated to KPFT. And we had it was a guy that was giving me a hard time in the chat. Love this guy, Glenn. He gives me a hard time in the chat because he doesn't think I am sufficiently, I guess, sufficiently hard on the Democratic Party. We had a great chat. When I tell you a great chat, I mean a great chat. We sat there for a long. Put it this way: it took two coffees. He had to drink two iterations of a latte for this guy. With the conversation went so well. And again, anybody wants, we can also do that in this show here. Anybody wants to for me to drive out to any part of within a 50-mile radius, I should say maybe a 40-mile radius. 50, it's okay. Within a 50-mile radius, I'll go out there and we'll meet somewhere in the middle. If you contribute to now this show here, if you contribute $250 by politicsandright.com/PayPal, I'll come out and have some coffee, drop all of this. Just means I'm going to stay up a few hours later to finish the show, all that good stuff. But anyway, folks, let's see what else we got here. Oh, Michael has something for the screen. Here we go. Here we go. Michael says, Egberto, KF has asked the public about their attitudes about both Medicaid and Medicare for more than 2 decades, and these two programs continue to be overwhelmingly popular among the public. In the most recent poll, about 8 in 10, 82% of Americans hold favorable views of Medicare, and more than 3/4, 77%, hold favorable views of Medicaid. You know what always bugs me? Why is it that there are less people who support Medicaid, right? Think about it. Think about it. Think about it. Let's see. We have to figure out what that reason is. Anyway, as that list shows, in the 2000 it was 70%. Now it is at 82%. I think that is great. I think that is great. All right, folks, I'm going to hold out for one more minute. Anybody wants to make a comment? 281-823-7747. Again, repeating, 281-823-7747. And we can go ahead and having coffee right now is what the Beer Kid says. And Eric says, what if I pay for your gas and coffee? Will you meet up? Hey, we met up, Eric. We met up like 3 or 4 times. I think you did buy one coffee with Egberto once at KPFT. Now you can go ahead and buy a coffee with Egberto at Politics Then right here on this one. Anyway, look, folks, let me see how to say this. Well, I don't have to say it. I can just play it because I already did it. I want you guys to check this out, and then we will take it on the other side. I want you to listen to how the boy genius, the infantile genius, only defined that way by those who simply believe that if you're wealthy, somehow it is relative to your intellect. Of course, that's not the truth. But I want you to listen to how Elon Musk handled a simple question in an attempt to seek some sympathy for what he's doing. And then we'll take it on the other side.
Up your other stuff? I mean, how are you running your other businesses?
With great difficulty. Yeah, I mean.
But there's no turning back, you're saying?
I'm just here trying to make government more efficient, eliminate waste and fraud, and so far we're making good progress.
Now, let's be clear. This is the same guy that went to a CPAC conference and displayed himself with a chainsaw for cutting jobs, for cutting down the government, for putting people's lives in misery. He wants some sympathy, right? He's trying to say, oh, this is so difficult. A simple question was asked. How can you handle this job and your companies all at the same time? That's the inference from this question. And the reality, of course, is none of these businesses were either from the intellect of this boy genius or this boy purported genius, or none of these businesses were created by him. These businesses were running before him. It continues to run without him, and they will run after he's gone. What Mr. Elon Musk is an opportunist. An opportunist who uses an economic system, a capitalist economic system that says the following. It's not necessary for you to be smart. It's not necessary for you to have any intellect. It's not even necessary for you to work. It is just necessary for you to be given the opportunity, the capital, and welcome into the club. Anybody who tries to say that this is a meritocracy is dreaming. Notice one of the big things the president came in with as soon as he got into office. DEI, get rid of diversity, equity, and inclusion, and give people the impression that diversity, equity, and inclusion, DEI, somehow gives people who are not deserving opportunity as opposed to what the truth really is. And of course, the truth really is it simply opens the door for giving people opportunity who otherwise didn't get it. That's all it's there for. It's not there to employ people that are not deserving or not qualified. In fact, the absence of DEI gives us somebody like Bobby Kennedy leading the Department of Human Services. It also gives people like Hegseth, who leads the Defense Department. It also gives the current replacement of the secretaries of the Secretary of of Army, Navy, the entire thing, right? All of these guys are not qualified. They just share one thing in common: their skin color and their sex. Nothing more. Their skin color and their gender gave them a job, not because they're qualified. In fact, each one of them replaced somebody less qualified. And Elon Musk, the person who is supposed to be revamping government, the person who is supposed to be making us more efficient, has shown with the job that he has done so far that he's not up to it. Number one, that he has failed at it, given the amount of people that had to be rehired, given the lies that they've had to tell to fire people, and given the lies that they've had to tell of what they've saved. This false boy genius that is supposed to save America, that is supposed to make America more efficient, is a fraud. And it is proven based not on what we think, but based on his work. Maybe if we reinstitute DEI, diversity, equity, and inclusion, maybe, just maybe, if we reinstitute that into government now, we will stop planes from burning up on the tarmac, from falling from the skies. Maybe we will be able to actually work a real defense type deals with other country. Maybe if we had a good DEI program, we could get competency in the Department of Education instead of the cadre of frauds that we have as part of the Trump cabinet. Yes, we need diversity, equity, and inclusion right now, and we need to rid ourselves of Elon Musk and his chainsaw. And it's important that we get something straight. Elon Musk is neither an engineer, a knowledgeable scientist, or any of that. To be squared, let me just say, the man has a Bachelor of Arts in Physics and a Bachelor of Science in Economics. That's it. Let's not give him these titles of engineer or somebody who knows technical stuff. He doesn't. And it actually, based on the works that he's done, it shows. It definitely shows. It definitely shows. Breach wants this on the screen. Let me read what it says. It says, the DOGE website is garbage. The claim savings has no relationship to the data provided, and the data that is provided grossly inflates the savings from each canceled contract. So we just launched our own site, the Musk Watch DOGE tracker that breaks everything. And it says, DOGE claimed $105 billion. DOGE itemized $29.9 billion. Verifiable cancel funding, $8.6 billion. That means they are 92% inaccurate. But it's even worse than that. Even as these are just contracts that are broken, that's not an efficiency. That is just saying, let's not do a contract. Oh, we save some money. You don't save money by just blanket cutting contracts or create efficiency that way. You create efficiency when you find a way to do something that needs to be done better. And he's doing none of that. The guy is a bona fide fraud. Let me put it to the side now. The guy is a bona fide fraud. Let's be clear about that. All right, what else have we got here? Paul Fleming says representatives of China, Russia, and Iran called Friday for an end to U.S. sanctions on Iran over its rapidly advancing nuclear program and a restart to multinational talks on the issue. Yeah, let's see what he says about that. Egberto Willis, Musk's trans daughter, has come forward with why Musk uses IVF. If it has been manipulated to have male children, which is illegal. I have a Facebook reel on that if you want, but seems plausible. Yeah, before we put something like that up, though, we have to verify that, my dear, beautiful Bridge MCP. All right, we also have from Bridge, Arlington Cemetery website drops in links for Black, Hispanic, and women veterans. Arlington National Cemetery is the most venerated final resting ground in the nation, overseen by silent soldiers in immaculate uniforms of acres in Virginia. They watch over 400,000 graves of U.S. service members dating back to Civil War, including 2 presidents, and more than 400 Medal of Honor recipients. But in the recent weeks, the cemetery's public website has scrubbed dozens of pages on grave sites and educational material that include histories of prominent Black, Hispanic, and female service members buried in the cemetery, along with the educational material on dozens of Medal of Honor recipients and maps of prominent grave sites of Marine Corps. Is that verifiable? Where is that coming from? Democratic Underground. Oh wow, I haven't posted there in a while. I need to start back posting at Democratic Underground. Thank you for reminding me about that. All right, let's see what else we got from Paul. I think what else we have here. Anyway, folks, I don't have any more videos to cover. So for all practical purposes, we're done with the part of the prepared show. So now it's all on you. Anybody wants to give me a call at 281-823-7747. Again, that number is 281-823-7747. Look at me adding another 7 to it. So give me a call. Una vez más lo voy a repetir. That is 281-823-7747. Alisarian Dream says, can we get the word out if anyone heard of a Houston area town hall? There are so many people, there are so many Congress people that intersect Houston. They're bound to have them. I mean, Hunt just had one, which was a doozy from what I understand. You know, so yeah, there are town halls to be seen. Okay, I tell you what, since nobody has called in thus far, there was a TikTok that I think I wanted you guys to see. Let me see if I can get to it before we run out of time here. I don't remember what it was about, to be honest with you, but I want to find it because I know. Oh! Stop that, young lady, stop that. Let's go ahead and see if I can get to it before the end of the show. My profile, my favorites, and see if I can remember which one it was. When Trumpers feel the effects of their decisions. Okay, this one. Let's see if I have enough time for this one. Yep, I got enough time for this one. All right. Let's go ahead and listen to this one. Let's go ahead and put it on the screen first. And there we go. That's on the screen. And let's do this right here.
Sociopathy.
Yo, watch this video of Donald Trump receiving a mental health diagnosis from some Canadian politician live on TV.
Trump's repeated comments about annexing Canada and his actions reveal a sociopathy that was described in detail in the 2017 book, The Dangerous Case of Donald Trump. In it, 27 psychiatrists and mental health professionals made it clear that Trump is a sociopath who poses a threat not just to the U.S., but to the entire world. Some of the assessments of Trump's personality in the book include the following, and mind you, these are assessments made by professionals who work in the area of mental health. Trump is an impulsive, immature, incompetent person who, when in the position of ultimate power, would easily slide into the role of tyrant. His sociopathic characteristics are undeniable and present a profound threat to democracy. He is profoundly an evil man exhibiting malignant narcissism. And, if left unchecked, his pathological narcissism could lead to World War III. I would encourage members of the media who haven't looked at this book to please take a look at it and get a real look into the kind of person that Donald Trump is, if you don't know already from the insanity that comes out of his mouth. To our political leaders, I say Canada cannot engage with him as we do with other normal leaders. He has shown himself to be an enemy to Canada, and we have to treat him as a clear and present danger to our country and to our allies. And to the Canadian media, I say, begin telling the story of the fascist sociopath occupying the White House using that language so that Canadians in the world know the very real danger he presents to peace and stability.
Yo, watch this video of Donald Trump receiving a mental health diagnosis.
Okay, so there you go. The Canadians get who Donald Trump is well. They are actually going through some of the old stuff that we had on several news programs, but it never hits the mainstream media because they're so scared to really talk about who Donald Trump really is. All right, folks, we only have a couple minutes or a little minute and a half to go. So let me do my ask and say, please, if you are watching this program, if you find this program engaging, informational, and entertaining, I want to ask you to support the program as best you can. Right, if you're watching the program on YouTube, you have the ability to join. Just click join to become a member of our PDR Posse on YouTube. If you are right now watching us on Substack, you can go ahead and click that subscribe button and become a paid subscriber. And I tell you, what you're doing is supporting quite a bit. If you check out what paid subscribers of our newsletter get, they actually get access to all 5 of my books that you can read on Substack. And you know what? Any subsequent book that I write will also appear on Substack for you to read without purchase or anything like that. And to do that, you just have to go to politicsdoneright.com/newsletter and become a paid subscriber. You get immediate access to all of my books. And again, you're not just becoming a subscriber, but you're helping us continue to put within the space progressive data on websites, TikTok, Instagram, Telegram, everywhere. We make sure and populate the internet with progressive, truthful, progressive information. We have the right wing that is saturating. You want to know why there are so many people that believe the crap that you see out there? That is because they have paid people in data forms that are just promoting lies throughout and making it look real. They make newspaper systems look like they're real newspapers, etc., to fool people into believing the crap they do. Well, we are doing our part in saturating the internet with progressive truths, not lies, truth. And you can help us do that by either subscribing to our newsletter, become a paid subscriber to our newsletter. You can also become a patron. How do you become a patron? politicsdoneright.com/patron is the way to become a patron. politicsdoneright.com/patron, Patreon. You can also support us by shopping at our store. I think, and that is politicsdoneright.com/store. Want to know what our store looks like? Let me go ahead and put that on the screen for you if I can get it there. And by the way, some of the stuff in our store was designed by some of you. See that particular cup that says PDR Posse? Bridge MCP designed that particular cup, right? So there are all these different things that you can get with Politics Done Right at politicsdoneright.com/store. So please consider supporting us the best way you can, because we make sure to really, really work hard to keep the progressive mindset out there. Anyway, it's 4:01 and I've got to go. Thank you so kindly, all of you. Love you all. My name is Egberto Willies. This is Politics Done Right. And you guys know how I end this baby. I am what? Out.
Welcome to Politics Done Right. I am your host, Egberto Willies. This is a progressive program that will take the mystery out of politics. This is the program that will encourage you to make sure government becomes we the people. Whether you are liberal, progressive, conservative, or otherwise, you get to air your point of view. We are an independent media outlet that, unlike mainstream media beholden to corporations, we only owe allegiance to you. Remember, you can also send me a tweet at EGBERTOWILLIES. That is at Egberto Willies. Let us engage. It is Politics Done Right.